A very good afternoon to Dr. Duri. Today I'm going to present my presentation, my assignment for early intervention about the developmental children, delayed children. Okay, I share the slide first. Okay, my name is Lee Yok Fong. I'm coming from Simparingam Learning Center. Okay, for the introduction for developmental delays, children grow and develop at their own pace from birth. We can notice that each child may have their unique learning style and different development progress among them. When child does not meet their developmental milestone at the expected times, they might face developmental delays. So, there are many types of developmental delays, such as language or speech, motor skills, cognitive, daily living activities, social and emotional skills. They have many causes for developmental delays, such as genetic defect, complication of the birth, environmental issues, and other medical conditions. Early intervention is a program that is designed for families of infants and toddlers with or at risk for developmental delays. The process intends to help children and their families with developmental delays. So different types of developmental delays have their own symptoms, and some of them might use the same reason. So now we talk about the speech delay. Speech delay is referred to a child who cannot speak or pronounce a word by reaching an edge. Ankyloglossia is a condition which the tongue is connected to the floor of the mouth. This situation will cause the difficulty of a child to pronounce some certain sounds like D, T, D, and so on. Okay, so the lack of verbal stimulation or abuse also can affect a child's development. Speech therapists will do some basic tests like simple communication with the child and understanding the child's situation with parents. So parents need to talk about the child behavior or child how they delay the speech to the specialist. So the speech therapist maybe will recommend the parents go to a hearing test after this to make sure the child don't have hearing problem. For the motor skill delay, problem with gross motor skill like walking, rolling, crawling, or holding a toy may be defined as motor skill developmental delays. They have two types of gross motor activity. The first one is big movement, which using arm, leg, and whole body. Another one is small movement, which is holding a small object. A baby who had brain damage before birth will lead to this problem, and we call it cerebral palsy. Cognitive impairment, which refer to intellectual function, are below the expected average according to the age, also will affect gross motor skills. Parents can bring their child to seek consultation with pediatrician for the further action. The next one is social and emotional developmental delays. This is a situation when children are not able to communicate with other children and adults. Children who related to autism and hyperactive normally also facing social and emotional developmental delays. Children who have abuse problems and parental neglect will affect their emotional control. Parents should seek for specialist consultation as far as possible if they have noticed the symptom appears on their children. And the next one, cognitive developmental delays. This is a condition which refers to children whose intellectual function is less when compared to standardized milestones. A child who has this type of delays also will be difficult to pay attention during their school time, even a short period. Genetic disorders such as Down syndrome and children who have verified as autism and ADHD may have the big chance to face this delay. A bad pregnancy condition like mother taking drugs, alcohol, or smoking during pregnancy times will lead to cognitive delays. Especially will take 2 assessments to evaluate the child's cognitive developmental delays. Okay, so now we're talking about the consistent for parents, childcare providers, and early intervention specialists. For parents, family is the main intimate role between child and the environment. The development of important abilities in childhood is related to the first social interaction of the baby, especially with their parents, as they play the role of first caregiver. Family who always have quarrel among members also will bring bad effect for children development. If a child who has speech delay, parents play the most important roles to help the child to get improvement, especially only able to provide the method for parents to teaching child speak or pronouns. Children with a severe delay may need a lot of assistance with daily living skills such as eating, walking, and dressing. So in this situation, parents should have patience when teaching their child to wear clothes by himself or herself. For childcare provider, when a child totally reach 18 months, parents can send their child to childcare center if parent is working. It can bring good effect for the children who had developmental delays if they're able to attend a suitable childcare center for them. Teachers can use per-media strategies to lead them more sociable. Children can build trusting relationships with teacher and peers, and they overcome the challenges. Teacher is the first person who realizes a child may face dyslexia. So teacher will notice the symptoms of dyslexia that happen on a child and inform parents. So when parents know their child has dyslexia, parents should take the further action, like take them for a screening. For early intervention specialists, this one can categorize as last stage of intervention for special needs children. The primary care physician should encourage children to share any concern they may have about their child's development of behavior, conduct and opportunities evaluation, and ensure that the child has attended developmental screening at the prescribed touch point. Specialists will provide the appropriate practice for parents to improve their child development and review the practice on the child. In this situation, parents should cooperate with specialists in this stage to make sure their child has the right solution, because it is very important for their bright future. Okay, so this is the recommendation on the best practice and assessment. I will test criteria refer assessment, arena assessment, and pay-based assessment. For criterion refer assessment, this is a process of evaluating the lesson, the learning of students against a set of pre-specific qualities or criteria without reference to the achievement of others. The pre-specific qualities or criteria are what children have to do during assessment in order to demonstrate that they have achieved the learning outcome. The early language milestone scale is a simple tool that can be used to assess language development in children who are younger than 3 years old. The test focuses on expressive, receptive, and visual language. It's released primarily on the parent's report with occasional testing of the child. The test can be done in the physician office, and it only takes a few minutes. Arena assessment. This is a technique in which all members of the multidisciplinary team surround the child and the examiner or facilitator and observe as they interact in multiple situations. Play evaluation. Formal play or pre-academic task communication item may be presented in this format. All members of the team record the child response throughout the evaluation session. The child interacts with just one adult rather than all members of the assessment team. Arena assessment allows for an interactive and integrated process across domains to get a holistic picture of the child. For play-based assessment, this is an observational procedure used frequently in early childhood education or for infants, toddlers, and preschoolers. Children will not feeling that they are being examined and they won't feel stressed. So during play, children spontaneously and authentically demonstrate knowledge, skill, and behavior. Specialists may provide blocks with work to let children who is dyslexia to play. They show a word for the child and ask them to build the block. If the child is dyslexia problem, they may not find the words, they cannot find the alphabet or words to complete the task. Okay, so the suggestion to enhance the early intervention program in Malaysia. Early intervention program provider can be easily found in city areas such as Kuala Lumpur, Johor Bahru, Georgetown. For rural area, parents have to get those programs. So they need to travel to city for consultation. For the traveling, so it may need a lot of cost and time. So although government health clinic also have provide specialist consultation like occupational therapy, it only provide once a month for rural government clinic because specialists are traveling from city to those areas and the demand is not so much high. So specialist service provided by private sector is much expensive if compared with government, which is free of charge. In this situation, government may help to set up more specialist centers for developmental delayed children, like provide occupational therapy twice a month at health clinic. Government also can provide more high educational programs in early intervention to grow more therapists for this service. Another issue is parental issue. Most of the family are double income family, so means the both parents need to work. So they will overlook their children progressive according to their aging. Sometimes they even need teacher to tell them what problem their children facing. There's another situation with parents thinking that teacher must bear all the responsibility for child progressive. Some parents feel that since they already paid schooling or tuition fee, so the teacher must pay full attention to their children and make sure they have same progressive as other same age children. An effective progressive or child must have cooperation among parents, teacher, and also the early intervention specialist. So as a conclusion, each child has their own developmental pace. Parents, childcare provider, and early intervention specialists must always work together to help children who is face developmental delays. They must know how's a child defined as developmental delays and what should they do for the next action. So developmental delays issue must get concerned and take action as fast as possible if anyone notices that their children have the symptom of delays. Thank you.